Hello dear friends, my name is Dr. Igor and I'm clinical oncologist practicing since 2010. And now we are continuing our playlist about blood pressure and we are going to talk about the first group of drugs against blood pressure, ACE inhibitors. ACE inhibitors meaning ACE is angiotensin-converting enzyme, or sartans is angiotensin receptor blockers. Does it sound frightening? Does it sound frightening? Long names? Yeah, agree. But in reality, it's not so frightening. Let's talk about it. I'm sure you will understand everything about these drugs. Okay, so what is angiotensin-converting enzyme? This is enzyme that is needed to produce the substance which will increase the tone of blood vessels. You remember that the higher the blood vessel tone, the higher the blood pressure is. That's why if we block this enzyme, the tone will decrease and the blood pressure will go down. Here, if you remember, we see ACE inhibitors, everything that finishes with pril. Captopril, enalapril, lisinopril, ramipril, and angiotensin receptor inhibitors are sartans, losartan, valsartan. These drugs are more expensive than ACE inhibitors, but they don't have some of their adverse reactions. Meaning, if the patient has troubles taking ACE inhibitors, can tolerate very well angiotensin receptor blockers or sartans. So, what's good about these drugs? They cause vasodilation, decrease the tone of blood vessels, and they increase the excretion of salt and fluid by kidneys. They may be very good, especially in patients who have diabetes, because they will protect kidneys that may be affected by both diabetes and arterial hypertension. And they may be very good in heart failure and after myocardial infarction. And most of them are taken once a day. That is very comfortable. What are the problems with these drugs? After the first dose, there may be quite a huge drop in blood pressure. That's why it's better to take it the first dose before sleep. And afterwards, usually once a day in the morning is taken. Next, dry cough is a common adverse reaction of ACE inhibitors, but if the person takes sartans, there is no such complication. Also, allergic reactions and edema, they can be caused usually by ACE inhibitors, but not by sartans. Next, functional renal failure. In the presence of renal artery stenosis, don't be afraid, I will tell you what is that. The kidney has a blood vessel, artery, that brings blood to the kidney, so the kidney can filter it, it can work, and it can produce urine, and it can regulate many processes in the body. And if this blood vessel is problematic, if there is an atherosclerotic plaque there, then these drugs may even worsen their kidney failure. So the kidneys cannot work anymore. That's why before taking these drugs and during the ACE inhibitor intake, you should monitor your potassium in the blood. You should monitor creatinine, blood urea nitrogen, to check if your kidneys are working properly. Also, you can check the arteries of kidneys by ultrasound with Doppler. Next one. ACE inhibitors may increase the potassium in the blood. That's why if the patient has already kidney failure, high potassium in the blood, if the patient is taking some medications that have potassium, if the patient is taking spironolactone or verapamil, the potassium-sparing diuretic, then it may lead to really huge problem. The potassium in blood may increase, and this is quite dangerous because it can cause some side effects. It can cause arrhythmias, even cardiac arrest. The heart stops beating. That's why please be careful, always monitor your kidney function, potassium and creatinine. Next, teratogenic effect, meaning it may be dangerous for pregnant women, causing damage to their fetus. But in general, these drugs are very good and they are the drugs of first choice for many patients suffering from high blood pressure. Dear friends, hope it was interesting for you, and I'm waiting for you in the next lectures. God bless you. Bye bye.